friends. My name is Chelsea and my topic is hospice. Hospice care is very near and dear to my heart. Last year, my mother-in-law died after being in hospice care about a year and a half. They visited her about twice a month and regulated her pain medicine and took her off of almost every other kind of medication she had except those that made her life more comfortable. The topic of death, dying, and bereavement makes many people very uncomfortable, which is weird if you really think about it, because the statistics are 1 out of every 1 person is going to die, and we're all going to experience this grief and sorrow of our loved ones dying. Dr. Elizabeth Kubler-Ross said, "We live in a very particular death-denying society. We isolate both the dying and the old, and it serves a purpose. They are reminders of our own mortality. We should not institutionalize people. We can give families more help with home care and visiting nurses, giving the families and the patients the spiritual, emotional, and financial help in order to facilitate the final care at home." She was at the forefront of the hospice movement. Hospice care is a team-oriented approach. Medical care, pain management, and emotional and spiritual support formulated to each individual patient's needs and wishes. Support is also given to the patient's family and loved ones. The team that interacted with my mother-in-law was her personal physician, who also happened to be the hospice physician, and 1 nurse, social workers, and 1 volunteer we saw. A few statistics from 2014, so these are a few years old. 1.6 to 1.7 million patients received hospice care. 58.9% received care at home, and at home that means private residence, nursing home, and also residential facilities. 31.8% received hospice inpatient facility care, and 9.3% acute care in the hospital. A little history on hospice. The name was first applied to specialized care for dying patients by physician Dame Cecilia Saunders, who began her work in 1948. She created the first hospice, St. Christopher's Hospice, in a residential suburb of London. In 1963, she came to Yale University and gave a lecture that started the chain of events that led to the current hospice care that we know today. Some of the research I saw showed that people who had the patients taken care of at home, in their home, residential home, seemed more satisfied with the hospice care. They liked how they were kept informed about the patient's condition, provided with clear, consistent information, and the perception that the patients were provided with adequate treatment for anxiety. And 2 other things that increased their satisfaction with hospice care was sufficient discussion with hospice team members concerning family members' religious or spiritual beliefs, and being provided with the correct amount of emotional support after the patient's death. There's a hospice in San Francisco that I think is the model of all hospices. Their 3 focuses are that the patient is not in unnecessary pain, and tending to the dignity to the senses, and the well-being of the patient. And the well-being, one of the comments that was made that I just thought was so insightful was to focus on the more wonderful instead of the less horrible. Another comment was ushering grief with warmth and a dignified, graceful end of life. Make everybody feel human and connected. Hospice offers dignity in dying. We won't avoid mountains of sorrow and the reality of death, but we may be more prepared and more prepared to care for our loved ones. Thank you.